This special news
from New York Governor Andrew Mark Cuomo, live from Albany at. Now, the meeting days ago, I forget where it was from, but right now, according to most polls, Andrew Cuomo is the most popular governor in the country right now. Now, even though I'm in New York and a lot of people, have disagreements with this governor, the main reason why people are appreciating Andrew Cuomo is for the, hang on, we're having a problem connecting to the stream. So we will try to connect back in just a second. Do apologize. So as I said, we are waiting any moment now to hear from New York Governor Andrew Cuomo. And people are appreciating the job that he is doing in New York State. The takeaway I want to give for yesterday was that there were a couple takeaways. Was that number one, the governor thinks that the curve may not flatten until July. I definitely agree with him on that. At this point, I will say this. We are expected, I think, to have the worst of the peak from now until at least, and if I'm giving an estimate, maybe it'll sound correct, at least until April 30th. The earliest I would say we could flatten this curve for COVID-19. There was a chart yesterday, the governor said, was that if we start now, let the peak go up, then we have a chance to flatten this curve by July 1st. Now, I'm hoping he's correct, because bottom line is, we don't know if the warmer weather will play a factor into, let's say, contributing to. I want to make sure my PS4 is off to apologize. But will the warm weather help? I think there's a possibility with all the humid summers we get in New York. There's a possibility. There's also the possibility that maybe the curve will flatten earlier in June. I'd hope so. We should be back on. We're back on Cuomo once again to give his daily COVID-19 update. So, another takeaway I will say yesterday was all New York City parks are closed. And it seems DeBozo, so I'm going to call him, finally is cooperating. And, we don't need large crowd gatherings right now. The bottom line is, listen, if you're going to go out, try to be a loner right now. Don't have people with you. Right? Every man for themselves these days. And, if you're a mother and you have children and you need to go out, every woman for herself too. Because right now, it should only be you. You need to go to the drugstore. You need to go to the supermarket. Maybe even go for a quick jog around the block or something. Right? This is not the time to even be with 2 or 3 people in a group right now. But playgrounds are closed. Parks are still open. But I did see over the weekend, well, last weekend that was, back on the, I think it was the 26th. I'll get the date. I know I charted it on my phone. Yeah, it was 28th. Oh, hang on. I think he's coming on. Okay, no, I guess not. Oh, also, one quick takeaway if the governor does come on shortly. If you are a doctor or a nurse downstate, upstate New York, you're going to be called into different hospitals. So keep that in mind if, let's say you're up in Schenectady and you need to go. Okay, looks like Andrew Cuomo is about to speak.
Good morning. Good to see all of you. All smiling faces. Almost all smiling faces. Let us give you an update as to where we are today. The number of cases continues to increase. We're up to 7,917. The number of people tested, again, is the highest rate in the country. and per capita higher than China, per capita higher than South Korea. We tested 18,000 people. Total tested 238,000, which is a lot of people, but remember, New York, you're talking on a base of 19 million, so number of positive cases up to 8669, 92,000 total in the state, predominantly in New York City, but you see Westchester and Nassau, which by percentage is a troubling number. Remember, New York City is so much larger than Westchester, Nassau, or Suffolk. So those numbers are concerning, and we're watching those. You look to see in Nassau County, 1,000 new cases. Suffolk County, 1,141 new cases. That is troubling news. Number of counties, you see the entire state. Every county in the state now has reported a coronavirus case. We said it was going to march across the state. I've also made the point to my colleagues on every phone call I do with the other governors, the other officials. I say it's going to march across the country. It is false comfort to say, well, we are a rural community. We don't have the density of New York City. That is a false comfort. You have counties in New York State where you have more cows than people. New York State, don't think of just New York City. Upstate New York is a rural community. And you see that it's not just urban areas, it's suburban areas. That's Westchester, Nassau, Suffolk, comparable to suburban communities all across this country. And we have rural communities that are comparable to rural communities all across this country. In many ways, New York State is a microcosm of the United States. And that's why I believe it's going to be illustrative for the rest of this nation as to what's going to happen. Current hospitalizations, as I said, 92,000 tested positive, 13,000 currently hospitalized, that's up 1,100. 3,000 ICU patients, that's up 300. 7,400 patients discharged, that's up 1,292. That's good news. Number of people going to the hospital is going up. Number of people coming out of the hospital is going up. Number of deaths up to 2,373, up from 1941. Looking for a trend line. The trend line is still basically up. Total new hospitalizations. Trend line of ICU admissions is still up. Certainly, a couple of small deviations, but the line is up. Number of intubations is up, but if you want to take an optimistic view, you could start to see a plateauing in the number of intubations, but the statisticians tell me that's an optimistic view. Number of daily discharged is going way up. That's people going in, people going out. Challenge is still at the apex. That's what this has been all about for every system in this country now. Everyone is basically waging the same battle. Different time frames, different numbers, different percentages, but it's the same battle. When you hit the apex, which is the highest rate of infection, highest number of people coming into the hospital system, can you handle that number? Can you handle the height of the impact on the hospital system, which is at the apex of the curve? We call that the battle of the mountaintop. At least I call it the battle of the mountaintop. Questions people keep asking, which are the right questions. Well, when is the apex? It depends on what model you use, what model you follow. We follow all the models. It's anywhere from 7 to 21 to 30 days, depending on what model you look at. Well, how can you have that variable, 7 to 30 days? It depends on how that model rates how effective social distancing is, right? The variable is the models that think social distancing is going to be more effective at slowing the rate have a longer time frame for the apex. Those models that discount the social distancing, they have a shorter time frame for the apex. It makes it difficult to plan, frankly, because 7 to 30 days is a long window, and we are literally planning on a day-to-day basis, deploying assets on a day-to-day basis. We believe it is closer to the shorter end of the range with our in-house people looking at the professional modeling that's being done. How many beds will you need at the apex? Between 70 and 110,000. Again, that is a broad range. Again, that's one of the frustrations trying to plan for this. Right now we have 53,000 statewide. We have only 36,000 downstate. Remember that. And this is primarily a downstate issue. So by any estimate, we don't have the number of beds, but again, we've taken extraordinary measures. Every hospital, by mandate, has to add a 50% increase, and they have all done that. We're setting up extra facilities, which we've been talking about. We've been shifting patients from downstate hospitals to upstate hospitals, and that is continuing. When does this end? You have projection models that have us hitting the apex, coming down from the apex. Models vary at how quickly you come down from the apex, but they all basically say you come down from the apex quickly. And then some models have it flattening out, but flattening out for a period of time. Models have it flattening out and continuing through the summer. How many lives lost? There's only one model that we look at that has the number of projected deaths, which is the IHME model, which is funded by the Gates Foundation, and we thank the Gates Foundation for the national service that they've done. But that is the model that suggests approximately 93,000 deaths across the country. That's the model that I believe Dr. Fauci was referring to when he said about 100,000 deaths. By that, New York would be about 16,000 deaths by that model. When we're doing this planning and we're doing our deployment, the theory is the chain is only as strong as the weakest link, right? So that's true for the hospital system. We have about, give or take, 180 hospitals that we are focusing on here in the state. The hospitals that will have the greatest issue will be those hospitals that are usually the most stressed in normal circumstances, right? So if the hospitals before this were under stress, you then add this crisis on top of that, those are the hospitals that one would expect to see struggling first. That's also true for the entire hospital system. You know, we talk about beds, we talk about staff, we talk about supplies, but the truth is you need all three of those things to provide any care. A bed without staff doesn't do anything. A bed and staff without supplies doesn't do anything. So you need all three of those components to work to have a situation where someone can actually get care. In terms of beds, those are the easiest to find, and we're constructing additional facilities. We're now going to start at the Brooklyn Cruise Terminal, obviously in Brooklyn, New York City. It's expected to open this week, 750 beds. We're taking a Office of Mental Health facility in Staten Island and converting it to a COVID-only hospital. So on beds, we are in relatively good shape because a bed is a bed, right? A bed is a question of a structure. Push comes to shove. We can acquire dorms, we can acquire hotels, we can acquire physical structures with beds in them. Of those three components, bed, staff, supplies, I personally am least worried about bed capacity. We have 2,500 beds at Javits. We have 1,000 beds on the naval ship Comfort. Beds we can find. Not easy, but we can find them. The harder components are the staff and the supplies, which is what we've been talking about. On the staff, we're continuing to shift staff from the upstate hospitals that are less impacted to downstate hospitals. We've requested out-of-state healthcare workers. God bless America. 21,000 people have volunteered from out of state to come into New York State. I thank them. I thank their patriotism. I thank their dedication and passion to their mission of public health. These are beautiful, generous people. And New Yorkers will return the favor. New Yorkers will return the favor. This is going to affect every place in this country. We are, in some ways, the first major encounter. We're learning, we'll get the experience, and we will return the favor. When your community needs help, New Yorkers will be there. And you have my personal word on that. And it's also the New York tradition. When there's been a hurricane or there's been a flood or Hurricane Katrina, New Yorkers are the first ones in their cars to go anywhere in this nation that needs help. And I will be the first one in my car to go wherever this nation needs help as soon as we get past this. I will never forget how people across this country came to the aid of New Yorkers when they needed it. And I deeply appreciate it. We have 85,000 volunteers now in total, which are being deployed to the hospitals so they can find staff that works for them. Supplies are an ongoing challenge. The PPE is an ongoing challenge, the gowns, the gloves, and the ventilators. First of all, we have for the first time ever a hospital-by-hospital survey that will be done on a nightly basis of exactly what they have. As I said, we're coordinating the healthcare system in a way it's never been coordinated before. Rather than having all these regional systems and public systems, private systems, et cetera, we have a central stockpile. We are asking all the hospitals to contribute what they have to that central stockpile, and then we will disperse on a need basis. You know, some hospitals have more supplies than they're using. We're saying, don't hoard supplies. Let's put all the supplies in a central stockpile, and then we will draw down from the central stockpile. And we will monitor this literally on a daily basis. I'm also asking on supplies. I don't have a New York Defense Production Act, right? The governor can't say to a company, we need you to manufacture this. But I ask businesses just to think about the situation we're in and a possible opportunity. It is the cruelest irony that this nation is now dependent on China for production of many of these products. Many of these products in the normal marketplace were being produced in China. And now you have everyone shopping China for PPE, gowns, ventilators. The gowns, the gloves are not complicated components to manufacture. The gowns are Tyvek or paper material. If you are a manufacturer who can convert to make these products and make them quickly They are not complicated products. The FDA lists the specifications for these products on their website. If you have the capacity to make these products, we will purchase them, and we will pay a premium, and we will pay to convert or transition your manufacturing facility to a facility that can do this. But we need it like now. You know, we're not talking about 2 months, 3 months, 4 months. We need these materials now. That's the stress. I understand that. But if you are in the garment manufacturing business, if you have machinery that can cut a pattern, you know, a coverall, you're not making a fashion-forward fitted garment, right? These are relatively straightforward components. So if you can do it, it's a business opportunity, it is a state need, it's a national need. Please contact us. We'll work with you. We'll work with you quickly. There'll be no bureaucracy, no red tape, and we'll finance. We're not asking for a favor from these businesses. We'll finance what you need in terms of transitioning, and we'll buy the product, and I will pay a premium because we need it. And this is a number for the Empire State Development Corporation, which is handling this task. In terms of ventilators, we released 400 ventilators last night to the New York City Health and Hospital Corporation. We released 200 to Long Island and Westchester. As I said, you see that those growing numbers in Nassau and Suffolk, and that is starting to stress that healthcare system. So we released those ventilators last night. At the current burn rate, we have about 6 days of ventilators in our stockpile, meaning if the rate of usage, the rate of people coming into hospitals who need ventilators, if that rate continues, in our stockpile we have about 6 days. Now, if the apex happens within that time frame, if the apex increases, if the apex is longer, we have an issue with ventilators. These numbers, by the way, are also going to be compiled every night. There's a difference of opinion. How many will you need? We'll need what we need. You know, I have no desire to acquire more ventilators than we need. The way we basically are acquiring ventilators is the state is buying them. They are very expensive and the state is broke, so I have no desire to buy more ventilators than we need. But we need what we need. If a person comes in and needs a ventilator and you don't have a ventilator, the person dies. That's the blunt equation here. And right now we have a burn rate that would suggest we have about 6 days in the stockpile. But we are taking all sorts of extraordinary measures. I've spoken to health people all across the nation. Dr. Zucker's done all sorts of research. And we have extraordinary measures in place that can make a difference if we run into a real ventilator shortage. First, we know where all the ventilators are in the state of New York, by hospital. If we have a problem in any hospital, we are going to take the ventilators that are not needed from the upstate hospitals and transport them to downstate New York or the hospitals that do need them, which again, more and more are going to be on Long Island. And then we'll return them or we'll figure out the finances of it and make those hospitals whole. We're also increasing the number of ventilators by ending all elective surgeries. If you don't need an elective surgery, a hospital cannot perform it. If it's not critical, that's freeing up ventilators. We're also using anesthesia machine ventilators without the anesthesia, obviously, but using them as ventilators. We're also so-called splitting ventilators. We put out a protocol. All the hospitals are practicing that now. one ventilator, two sets of tubes can do two patients. It's not easy, it's not ideal, but it's better than nothing. We're also converting what's called BiPAP machines, which are, again, don't have the same force as a ventilator, but on an emergency basis, some research has been done that says they could be suitable. We are also still in the business of looking for ventilators, to buy ventilators. It's too late to ask a company to make them in any way that would work for our time frame. You look at our time frame, 7 days to 30 days. No one is going to be able to make a ventilator for you in that period of time. Nationwide, parts of the country that have a later curve, yes. If you give a company 2 months, 3 months, they can ramp up production, but not on our curve. So we have to find ventilators that we can buy, and we're still doing that. And again, the main place is China. We're converting the BiPAP machines. This has not been done before, but Northwell, which is one of our premier healthcare systems, has developed a protocol, and they're teaching the other hospitals now how to do it. We just bought 3,000 BiPAP machines, and 750 came in yesterday. So yes, the burn rate of ventilators is troubling, and 6 days of ventilators in the stockpile is troubling, but we have all these extraordinary measures that I believe, if push comes to shove, will put us in fairly good shape. I don't want to say yet. I'm confident, and it depends on how many we need, but I can say with confidence, we have researched every possibility, every idea, every measure you can possibly take to find ventilators. This state has done. That I can promise you. We're also going to open the healthcare exchange enrollment period through May 15th. We have about 96% of the people in this state are covered with health insurance. If you're not covered, we're extending the enrollment period to May 15th. Please get covered. You can go to the New York State of Health website and sign up. My brother, my little brother, I only have one brother, Christopher, tested positive for coronavirus. A lot of people are concerned about him, obviously, people in my family, but even beyond that. New Yorkers are very compassionate, and many people ask me about Chris and how's he doing, not just for himself, but we keep talking about this coronavirus. I'm afraid of it. I'm anxious about it. What does it actually mean? Okay, your brother has it. How's he doing? So a lot of people ask me that question, and I talk to him quite frequently, and he is doing okay. And I checked in with him this morning and asked him how he was feeling, and he was up and spry and much his normal self. I invited him to join us for a couple of minutes if he was up to it this morning. And I think he said that he was in a position to join us. And I asked him to join us by video if he's available. There he is, with his hat, Cuomo prime time. Say hello to you. There, I saw it. It's hard to miss. You're looking.
Let's get after it.
Let's get after it. I love that saying. You're looking fit and fine. Many people are asking about you. I tell you the truth, everyone I talk to is asking about you and how you're doing and how you're handling it and how you feel. Kara's here, by the way. She's working with me now. She's working on supplies. So she says hello. So how are you feeling?
I love Cara. You have great kids. There's no better way to measure what you've actually meant in the world and the kids you bring into it. And your daughters are great, and I'm not surprised that they're helping. They make me proud of the family. Thank God the next generation is better than the one that brought it into this world. I'm doing pretty well, all things considered. This is very tough. I get it now. I've now become part of this group of people who have this virus, and they're reaching out and friends and people who are new friends. They have this 5, 8, 10 days, constant virus, constant fever, and it's tough. And, it's not doing great with my hair. I have to be honest. It's tough to keep hair the way I want it to look. You look like you've been cutting your own hair, which some people are good at, some people are not. So I've chosen to wear a hat because I don't want to butcher my own haircut. But it's going to be a long slog. But now that I know the fight that I'm in for, I'm more comfortable. And I've learned that I see why it takes people out. You got to rest because your body has the fever because it's fighting the virus. And you've got to chill. I'm very lucky. I have a wife who loves me, who's keeping me fed. I got a nice place to be. So many people don't. You've been very smart, Andrew, in getting people to think about how they can reach out and help people without contact. A lot of people are fighting this alone, and I can't imagine that. I can barely, keep it together, and I have everything done for me. Very lucky. There are a lot of people who are in a bad way, and they're reaching out to me, and I feel for them. So we're in a real fight, and we really do have to remember our connections to each other, because otherwise there'll be no way through.
You're on what? You're on day 2?
Yeah, I really believe that it didn't start until I got the diagnosis, maybe because psychosomatic or whatever. But that night, I got hit with fever and those rigors, spelled like rigors, R-I-G-O-R-S. But it was like out of a movie. I tell you, I had the hallucination. I was seeing pop. You came to me in a dream. You had on a very interesting ballet outfit, and you were dancing in the dream, and you were waving a wand and saying, "I wish I could wave my wand and make this go away." And then you spun around and you danced away.
Well, that's there's a lot of metaphoric reality in that one. I thank you for sharing that with us. It was kind of you. Obviously, it
I can't get
has.
that picture out of my head. That's all I see. And I look at you.
Obviously, the fever has affected your mental capacity. And
Yeah. And being alone all the time. I think everything I say is funny.
So you still have a fever? Do you have a fever today?
I have a fever right this instant, Governor.
Really? Well, you look good.
Oh, yeah.
I have to tell you, comparatively, you look good.
Well, first of all, I appreciate that. I must point out to your audience that you have expressed concern about how I look after today's appearance several times. And you didn't like my hair. You thought that I was giving a bad look of survival of the virus.
No, look,
I think I'm doing okay.
Good. You look good. You sound good. I know that sometimes we joke. I'm not going to do that today. Rule 1 is never hit a brother when he's down, and you're literally in the basement. So I'm going to refrain from any rebuttal today. I
don't know, Andrew. I have to tell you, this is probably your best chance. Because when I'm healthy, you know what happens when we go toe-to-toe and I'm healthy. So really, if I were you, now's the time to strike.
Yeah, but see, that's...
You may get sick, but I would come for it now. Once I'm healthy, I'm not going to forget all the jokes you made at my expense. I saw the picture you showed of me the other day.
No, look...
Raised my fever.
No, look, first, I have no doubt that you would hit me when I'm down. That's the difference between us, and that is my point. That's not who I am. I hadn't made any jokes. It was not a joke. Some people misinterpreted what I said. I said that I was going to send you a book, because I know you're just walking around the basement there, that I was going to send you a book on a beginner's guide to striped bass fishing. But that's only because, you normally fish for porgies, And it's totally different to fish for striped bass than porgies. I was never saying anything that was in any way offensive.
Well, I appreciate the book. I like to learn. I love to read. I love to fish with you. It's one of my favorite things to do. You're the only person I've ever known who fishes in all white, because you have no expectation of getting any kind of fish or any type of substance on you at any time when you fish, which has been great training for the virus. You have lived a sterilized existence pretty much the entire time I've known you.
Yes, I believe you can fish and still stay neat and clean. I'll tell you this.
I love these press conferences. I think you should have one every day.
Yes, I have been. I know you haven't noticed.
Oh.
Yes.
Sorry.
Yes, it's sort of like the way you have a show. Yes, I do a briefing. You have Cuomo prime time, I have Cuomo all the time. That's the difference. Yeah,
The hats are available. by the
yes,
way.
it is a good-looking hat. And 1 hour a day. I work 23 hours a day. That's like the mathematical balance. But
You
anyway,
need you to. You have to stay.
Yes.
That's your job.
that's my job. I do believe this is going to be a great public service in a ironic way. People are curious about coronavirus. What does it mean? What happens if I get the virus? You living it, showing it, doing the show, reporting on how you feel, reporting on what you're doing. I think it really it demystifies this. It takes a lot of the unknown out of the equation. And I know it's a terrible, unfortunate circumstance for you, but think about it from a journalistic point of view, a public service point of view. You are answering questions for millions of Americans. If I get it, what happens? What do I do? What do I look like? How about my family? By the way, best news is, thank God, your family doesn't show any symptoms. Knock Formica, yeah. Because if your wife had any symptoms, you would be in the basement for a lot longer than this virus would keep you in the basement, my brother. But
Let me tell you, I don't know how I would do it without it. I mean, I've always been emotionally dependent on my wife, but now I don't eat without Christina.
that's a
The
problem.
kids won't come anywhere near me.
Yeah.
The dogs won't even come down the stairs.
Well, is
I
that,
had to trick the dog to come in to take a picture with it.
is that a relationship issue, or is that like a canine instinct issue?
I think that, people get into survival mode, and they're like, look, big dog went down, doesn't mean we all have to go down, and they are keeping their distance. I get a FaceTime alert every once in a while. I get a text message. They are all very proud of you and what you're doing. I know how hard this is for you. I know it's frustrating when you can't control what you need, and you know what you need, and you know how important it is, and you can't get it. And that is very tough. And I've watched it in real time with you. And I can tell people, of course, I'm your brother. I'll never be objective about you. You're my favorite guy. But I've never seen you work harder than now. And I've never seen you have this kind of desperation to source equipment, and you're drawing in from everybody you know. And you've done everything you can to stay positive with the federal government. And that is so important right now. And you're doing everything you can. Unfortunately, look, what's one of the big lessons in life that Pop always used to tell us? Certain things you're not going to be able to control. Certain things are going to happen. This virus is one of them. It happened. It's going to run its course. You guys can't put a number on it. I know there's a huge temptation to do it. I know you're using the models. I talked to Dr. Fauci and all the different experts. People want timing, but we got to be realistic. We don't know how long it's going to last. We only know what we control, which is staying away from one another. And if we do that well, things will go better. But sometimes in life, you got to ride it out. And when one of those experiences now, people will remember this period, maybe more than any other period in our lives. And people will be remembered for how they stepped up right now and what they did and what they didn't do. And I'm very proud of you, big brother. I'll tell you that.
Well, look, I've said at this briefing, this is a transformative moment for the state, for the country. I believe that. I also believe it's a moment where you really see what people are made of. When the pressure is on, that's when you see all the cracks and you see all the strength. It's easy to be nice when everything is nice, but when the pressure is really on. And for you when they told you you tested positive, you know, a lot of people's instinct would have been to get in bed, pull the covers over your head, and just lay there. For you to get up, do that show, share with people, that is a strength and a character strength that is really incredible. And you know, we joke a lot, but the strength that you showed here and the dedication to journalism and your skill and your ability to make this okay for people and to communicate it. You can do the coronavirus, have the coronavirus, but you know, life goes on. I've been saying 1,000 times, 80% of the people get it and they will self-resolve, you know. But you're showing that. And not many people would have stood up the way you have stood up. And I've always been proud of you. You know that. On a basic level. Not only do I love you, I've always been proud of you. But I've never been prouder of you than I am right now. You go get some rest. I love you. Everybody loves you. This is going to be fine. You're going to get through it, and you're going to do a beautiful public service in the meantime. And I'm proud of you. And then we'll go fishing, we'll have a drink, and we'll laugh about it. Go get some rest. Thank you for taking the time.
Can't wait for that. And I know that I have to take care of myself. I won't do the show all the time. I'll do it whenever I can. People have been very nice in saying, don't work too much because you don't want to compromise fighting the virus. They are right. You're right to say that as well. And I hear all the advice. I love you. Thank you for letting me join today. I'll enjoy watching this now that I know it's a regular thing. I'll watch it every day because I'm stuck in the basement.
Thank you. Thank you for saying such loving, supportive things.
If you need me, you know where I am.
Rule 1, never hit a brother when he's down, in the basement. Love you.
In the basement.
In the basement.
Love you.
Ciao. Questions? Let's do the coronavirus questions, and then any local questions we'll do afterwards.
Albany and Newburgh have said they're interested in mandatory curfew.
Okay, so once again, that was New York Governor Andrew Mark Cuomo. Pretty much, I will show you a couple of the highlights if you are just joining in late. Out of the most respect, I am not going to be showing the Q&A session of the governor's briefing. So, this is interesting. Francesa is on Twitter. Mike Francesa is making a rant fest on Twitter right now. This is not the time to be doing this right now, Mike. I'm sorry, but jeez. You know, the governor's giving vital information to 20 million people in this state right now. Right, hang on. Let me ask Siri. Siri, how many people live in New York State?
As of 2015, the population of New York was 90,790,000.
Told you, 20 million people. 8 million people live in this city, by the way. And 2 million live in my borough. Alright? So when I want to hear, okay, I don't need to see the governor's butter right now. You know, I'm on Facebook, and I'm seeing negative responses for showing Chris right now. Give me a break. Give me a break. You know? Crazy. In fact, I'll go on Twitter right now just to show you how Mike Francesa is going on a rant fest again. Pull it up here. I think we can get it up. Can we put the window capture instead? Yeah, we can't put me, so I have to get rid of that. There we go, that's better. Okay, so here's what Francesa says. Okay. The network I was watching just went away from Cuomo, okay? And rightly so. And look at this. This is a pathetic excuse. Okay, folks. Okay. The governor has TV presence. Okay? Jeez. Seriously, you got people like him who are dividing us right now. My goodness. Oh, and here's a quote from Dr. Anthony Fauci. And by the way, Anthony Fauci isn't even on Twitter. Which, I hate to say this, he should be on Twitter. Same with Dr. Deborah Birx. Why isn't she on Twitter? Why isn't David Zucker on Twitter? They should be giving us updates online. Alright, so look at this. This is just a joke. This is just a joke. Mike, this is so stupid. Why can't Francesa figure this out? We have 19 million people who live in this state. We're the third most populous state in the union. Texas is 2. California is number 1. And what I can't understand, and this is what, I'm going to show you this person for a second. I'm going to show you this person. Why doesn't WOR carry Mr. New Yorkers Love Me speech? See what I mean? See what I mean? They should be carrying it. See, keep in mind that Andrew Cuomo is still Mr. New Yorkers Love Me. Well, I love him right now. I don't have to love him another day after Corona dies down. This is what I mean. This is what I mean. He's supposed to be the sports commentator. Okay? You can't make this stuff up with Mike Francesa. You just can't. Okay, I want to mention this tweet that Andrew tweeted out yesterday, and if we can move it down so I can at least look at me at the same time. Okay, there we go. That should help it. Okay, so this tweet that Andrew Cuomo sent out yesterday was Apple tech company led by Tim Cook, who, made my iPhone in China. According to the Apple packaging, if I could still find the Apple bag in my room. I think I had it somewhere, but that's not important. Apple's going to be donating 1.9 million masks to New York State. Right now, we need 19. Right now, we at least need 20 million for this whole state. 25 million just in case, because you never know. Because there could be undocumented people in the state who are not counted for. But still, 25 million would be a safe number. So, still, I am grateful that Apple is being cooperative here. So I guess the main takeaway I'll give for Andrew Cuomo today would be a couple things if you're just joining in late, and I'll just check your comments. Quickly want to mention the city of New York. I'll mention this every day. Let me see. Is it 692-692? Yeah, I think it's 692-692. That's the number I get the updates from every day. 692-692. I will mention, yeah, here we go, because I know the city of New York has it. Yeah, okay. If you want updates daily, text COVID to 692-692. That's 692-692 if you are a New York City resident. I know I am, so I'll just mention that. Okay, couple takeaways that we are going to talk about today. The first I want to go into is this tweet. I'll shrink me down so you all can see this. That's better. Okay, so the governor today announced 2 new temporary hospitals. Let's put it up large screen so you all can see it. Okay, so Andrew Cuomo today announced that 2 new hospitals will be in construction. One facility will be at the Brooklyn Cruise Terminal in Red Hook, Brooklyn. Construction has in fact started. They will open the facility sometime next week, and they will be adding 750 beds. Now, I'm assuming these beds are going to be for, obviously, COVID patients. And then you'll obviously have the ICUs, I guess. And then COVID-only temp hospital, OMH South Beach facility. I want to get into this tweet. I will get into it later on before I wrap up the stream. I got from Andrew Lee, who is one of our contributors to this YouTube channel. He is, of course, I'm trying to see if I can get this tweet out to you all. Hope I can get my passwords on here. Yeah, here we go. Like, it should let me log in. There we go, thank you. Okay, so if you're on Twitter, you can check my feed at Andy's Randomness. Okay, Staten Island. Okay, this is where I need Advanced Player to help me out on this if he's still watching. Because he's our, he's one of our super fans, and I have to make him one of the mods once I'm done with the stream. But, yeah, the update right now is COVID-only temporary hospital, OMH South Beach facility, will be open for coronavirus.
It's freezing.
What are you doing in there?
Can you make this bigger? Kathy sent me this and I can't read it.
Damn it, can you get out of the way?
Look, that's so rude.
I'm okay, what do you need?
I want to see if I can make that bigger so I can read it.
Sorry about that.
Who are you talking to?
On the phone, what? I put it on mute.
Who are you talking to that you're yelling at?
Because you just barged in
Sorry,
here.
but I want to read that. It's crazy. How do I make that bigger?
Like what bigger?
This whole thing that you put, how do I make it larger?
Okay, so this is what I have to teach my mom. Unbelievable. So when you're on iMessage, what you have to do is...
Just make it bigger. I have no time. I have to go eat because there's another Google at 1 o'clock.
Another Google?
A Zoom at 1 o'clock.
Oh
I have
my
to go.
goodness.
I
Another
have
one
a-
today?
Yes. Can you just make it bigger? Just do it now. Don't tell me how.
Here we go. Zoom in, zoom out by pinching. Sorry about that. I want to apologize. Now, where were we? Okay, Staten Island. So, Advanced Player, please help me out on this. South Beach facility will only be open for coronavirus patients only next week. So, once again, if you're just joining me, Andrew Cuomo made the announcement earlier that construction has started at the Brooklyn Cruise Terminal in Red Hook. 750 beds. COVID-only temp hospital in OMH South Beach facility will be open next week. I gotta lock this door. You know, this is unacceptable. Apologize, folks. I'll start locking doors from now on. There we go. That's better. Do apologize so we can prevent mistakes from happening like that again. That was my mom, folks, in case you were wondering. Alright, the next takeaway. Let's get back on track. Do apologize. Medical supplies. This is the main takeaway I want to get into. So, I will mention this is important if you're not in New York and maybe you want to donate medical supplies. Maybe it could be ventilators. Maybe it could be face masks. Maybe it could even be hand soap or something, or toilet paper, because we desperately need toilet paper in New York right now because people are just hoarding it like crazy. I was just watching Pine Power LI's video before the governor spoke, and very alarming to see the Target in the Broadway Mall out in Hicksville. They have no toilet paper, and obviously, you know, if I was that desperate, I would have just walked down the street to Newbridge and Old Country and went to CVS, but that's a whole different story. So, bottom line is, if you're in Long Island, you're in the Hudson Valley, bottom line is, New York City overall, especially here in Queens, we need medical supplies. Like, let's say you're in Florida. Maybe you want to UPS something overnight, FedEx it, I don't know, do the old-fashioned post office. Bottom line is, please reach out to us. We need help. We need help urgently. So if you have any necessary medical supplies, once again, face masks, ventilators, be hand soap, could be, what else? Jeez, I can't think straight. Just anything that could help. You can call 212-803-3100. Once again, that's 212-803-3100. You can also go on, also email State of New York, COVID-19 supplies at esd.ny.gov. So please keep that in mind. Once again, this is on my Twitter feed at Andy's Randomness. So if you do have any necessary medical supplies, please reach out to us here in New York. We are that desperate for medical supplies. And right before Andrew wrapped up the press conference, he invited his brother, the anchor of Cuomo Primetime on CNN, Christopher. So Chris was nice enough to actually join along, and Chris right now is doing a show on SiriusXM channel 124 right now, because I know Chris is on twice a day. He does a SiriusXM show from noon to 2, and then he does CNN at 9 o'clock. So thankfully all of that's on the SiriusXM app, because my new routine now is just getting updates from Chris, because you know, I will admit that Chris doesn't really want to talk about numbers or the other sad things. I mean, yeah, last night he did have friends of a doctor who passed. But bottom line is, right now, we're dealing with, you know, just something we've never seen before. Something we've never seen before. I don't want to really get into it, but also, again, if you didn't see yesterday's conference, again, there is a possibility that we could see the cases start to go down sometime around May 15th. I am realistic, and I agree with Andrew, is that the cases could go down by that date. I'm really optimistic that we can... Yeah, this is the time frame. I took the picture yesterday when I was watching from WABC's feed yesterday. But, yeah, we could be looking at May 15th, the earliest we could see the cases start to go down. I am really hoping for a miracle, and this is just the way I feel about it, that May 15th could be realistic. There is a point where it should start to go down from May 15th, and then hopefully see that number 0 come by July 1st. So I'm being very optimistic that we could resume the large crowd gatherings sometime in July or August. I'm hoping at this point. And, you know, I'll mention... Oh, not this picture. What's the other picture from yesterday? Where is it? And I had it from yesterday. Yeah, all playgrounds are going to be shut down in New York City. So, bottom line is, go to a playground, not going to happen. Okay, so Andrew Lee gave me this tweet last night, and this is a very alarming tweet, and I even told my dad about this as soon as I woke up this morning. I had to make him aware of this very alarming tweet I got from Andrew Lee. And it seems the media has been making a big deal about it, which they should, no question. So, we got this form from the Regional Emergency Medical Services Council of New York City. And I quote, this is a press release that was released on Tuesday the 31st, right? Okay. So, in order to ensure the safety of our providers who are also providing care to our patients, the following changes have been made in the cardiac arrest procedure. So again, this is only in New York City. This is only for New York City right now. I'm debating if I should take this or not, but Nassau County Executive Laura Curran is about to give an update, so I may join in just a second, because the media is not going to cover that. The city stations won't cover it, so we'll join News 12 Long Island in just a second if they will allow me to come on. have to get rid of my ad blocker because then they won't take me on. But I will get into it in just a second. Do apologize, folks. I'm trying to get Long Island on here. I can't get Long Island on here, it seems. See what I mean? I don't want to get into it, but guess what? Shooting in Long Island last night. I'm not going to talk about that. Somebody got shot in the concourse. So you have to go online just to find these non-corona related stories, but I don't want to get into that. Okay, cardiac arrest. No adult non-traumatic or blunt traumatic cardiac arrest is to be transported to a hospital with manual or mechanical compressions in progress without either return or spontaneous circulation. So, yes, pretty much what this means is they are not allowed to transport a cardiac arrest patient to a hospital. So again, like I've been saying, it's every man for himself. This is what martial law looks like. You're going to see these type of incidents, even if it's non-coronavirus related. So listen, you're on your own. I hate to say it, but you dial 911, I don't know what to say anymore. I mean, normally I just tell people only dial 911 for an ambulance. I hate to admit it, but only call 911 if you need the fire department right now. I hate to say it, but this is not the time to be calling 911 for an ambulance. You're on your own. I hate to say it. Anywhere in this country right now. Because last night, I found out that there was a huge fire in Dover, Delaware last night. Alright, so we are going to go live to Mineola any second now. We are going to join Nassau County Executive Laura Curran. She is giving her daily Nassau County update. As I said, we are not going to join Bill de Blasio because, again, it's just not... Bill de Blasio and Donald Trump are just not giving accurate information right now. Bottom line is, I'm trying to give you the most accurate elected officials right now. We need to hear from Laura Curran. We need to hear from Andrew Cuomo right now. So, we will join Nassau County in a second. I do apologize about the ad. We will join Laura Curran in a second. So, let's join right now. I will turn my camera off. And we will be watching News 12 Long Island live for Laura Curran's daily coronavirus update.
Cases in New York State, 2,373 deaths reported, and the governor...
Okay, folks, I do apologize right now. News 12 Long Island just showed the podium for Laura Curran. It seems right now we are not going to be able to link up with Nassau County Executive Laura Curran right now at the moment. So I don't really want to play the numbers right now, but I will just, go to me in a second, so we'll put me back on. So, as I'm trying to say, folks, please do not dial 911 unless you need the fire department right now. Because if you're calling about coronavirus and the fire... Here's the thing about the fire department that I know very well, because I work in healthcare. Most cases, when you request an ambulance in the city of New York, you're actually asking the FDNY to get involved right now. The bottom line is, and I know this for a fact, and I'm going to give my firehouse a shout out in Fresh Meadows. Just a second. I know they're on my map. Oh, I hear a siren going by right now. Look at that. That's actually welcoming. It's been so quiet here since Corona started. But I will say one positive thing before I shut out my firehouse. I want to thank everybody in Fresh Meadows, honestly, who have not been driving on 73rd Avenue by my house. Because, let me tell you, folks, I have been so relieved to not hear a car horn honk. I have been so relieved that, this is like the first time I've heard an ambulance in days. Like a siren. Like, this is a welcome sigh of relief because it's been so quiet. The only thing I hear is like people walking outside of my house. Like people walking their dogs, which that's understandable. I get that. Okay, so let's give an example, and I know this for a fact. Engine 299 on Utopia Parkway. I know this for a fact. They have an ambulance ready to go. Their own ambulance. So, let's say there's a fire in my area right now. Like, let's say, I don't know, there's a house on 65th Avenue, for an example. They need help right now. Let's just give an example. You're pretty much saying, help, help, I need an ambulance for, we may have the corona. And I'm like, okay, but what if there's a fire right now? What if somebody actually needs help in a fire and that ambulance needs to take you to the hospital because you may have smoke inhalation? Be smart, folks, please. I'm saying this right now, and the mayor should say this today. Only dial 911 if you need the fire department. That's it. If a vagrant assaults you today, don't bother the police. Don't even bother them today. Because the police, honestly, right now, are not going to help you. They are not going to help you until corona dies down. They are not available. I can understand why they're not available. They want to stay home. I get it. I'm sure if I dialed somebody at 107 right now, they won't even pick up the phone. They won't pick up the phone. I'm being completely honest, folks. Please. If you are in the city of New York, only dial 911 if you need the fire department. If you have a fire, dial 911. Because I know this for a fact about 911 and the fire department in the city of New York. Here's the thing. The police dispatchers, who do a good job, I will admit that for the city of New York, they will transfer you to the FDNY dispatch. Because, let me be honest, folks, I'm sure there are fires right now in the city that aren't getting reported by news outlets because they are too busy covering corona. They're too busy with it. Now, let's say, I don't know, you get injured. Maybe you get hit by a car. Maybe dial them. I don't know, because what if the ambulance doesn't show up? Somebody got ran over on Queens Boulevard the other day. Hang on, I'm just checking News 12. Do apologize. Yeah, they're in commercial right now, so I don't see if Laura Kern is giving an update right now. Unless I am wrong. Okay, we have an update. Laura Curran is saying that there's a possibility that 7 million people combined in Nassau and Suffolk are going to get corona, which, honestly, she could be right. She could be right at this point. I don't know. Again, I'm not an elected official. I'm not the one saying what's going on here. But, bottom line is, you are looking at a situation where you could see Long Island being the hotspot. Could be possible. I'm praying not, please. I have friends in Long Island. I don't want them to deal with what we're dealing with in Queens. I really don't. Being honest here. Okay. Yeah, I don't want to get into any more, but it looks like the county executive is not speaking right now. But again, I don't know what to do in a situation if you get hit by a car now. Because, first of all, who's even getting hit by a car now anyway? You shouldn't even be leaving your house. But, or car accidents. But the bottom line is, we need the FDNY right now if there's a fire. We need them. We 100% need them right now. So, I am suggesting to Bill de Blasio today, go on TV and tell 8 million people right now, only dial 911 if you need the fire department. That's it. Sorry, no police. Maybe for the ambulance. Maybe. I'm not saying cut that off completely. But if you need police right now, again, you're on your own. This is what the New World Order looks like. This is what martial law looks like. But I'll say one positive thing. I want to thank the FAA. Because if you live in Fresh Meadows or anywhere in northeastern Queens, you notice how stupid airplane noise gives you a headache. I mean, come on. And I'm very glad that there hasn't been any airplane noise when I'm sleeping, even though I fall asleep late, because honestly, it's like, what's the point? I mean, I don't need to be up the next day early. But, I texted my supervisor yesterday, and I'll tell you what I texted her. Pretty much, this is what I texted her. I said, bottom line is, out of an abundance of caution, I don't think it is a good idea for me or any of my fellow staff at the New Hyde Park campus to go into the facility right now, because the New Hyde Park campus, they're dealing with something they've never seen before. They don't need to be overwhelmed with non-essential staff right now. Yes. I even told her what the governor said yesterday. This curve, again, may not flatten until May 15th. So, there was one thing when I didn't have work 5 years ago, first thing she told me, sit tight. I love that line from her. But, listen, I'm sitting tight. Look at me. I'm just sitting here talking to you. And, I told her, look, I said, I hope to hear from her soon. But, she has iMessage and she hasn't checked my messages. But, as I was saying earlier, I don't think Andrew is going to possibly lift the non-essential, at least right now we're looking at a situation of April 16th, and that's 2 weeks from today. I mean, I want to honestly be optimistic about everything right now, but we're in a different situation today. We're going to be dealing with this at least till June and July. At least till then. And I'm hoping and praying right now that the warmer weather is going to kill off this virus. Just like how with the flu. With the flu, you were always worried about when's flu season going to be over. Is it normally April or May? I even told my mom this, and she agreed with me, is that let's say they have a vaccine right around the same time that they have the regular flu shot out. Trust me, I'm getting a vaccine. I'm not taking any chances. I'm not. You know what's a joke in 2020? I'll say this right now. How in the world, in 2020, do we not have the vaccine testing going faster? Explain that to me. This is supposed to be the science fiction future. This is the wonderful 21st century where humankind was supposed to make advanced stuff. No. Didn't happen. And I remember in 2009 with swine flu, I remembered. They said it's going to take a year for a vaccine. It's going to take a whole year. Yeah, and then they said September, and then it came true at least. I'm sorry for ranting, but, I just wish people would hear me out, And And I will mention this one last point is that, yes, again, I've been hearing reports that NYPD has been getting clogged with 911 calls. And I will mention this. They are actually saying that this is the most amount of 911 calls they're getting since 9/11. And let me tell you, that's very alarming. Very alarming. Now, obviously, if this was 9/11, it would be a different story. I probably would be telling people, if you're in Lower Manhattan, if you're not in Lower Manhattan, don't dial 911. That'd be a whole different story. But, we're dealing with something that we've never, ever have seen. So I'm praying for everyone right now. Really am praying for everyone. So, again, News 12 Long Island isn't showing Laura Kern right now, so there is no video. So, yeah, I think with that, I'm going to wrap this up. I'll try to be back tomorrow because, again, I want to at least keep in sync when Andrew Cuomo speaks because, again, with the media here in New York, they don't seem to do a good job breaking in. Even during a commercial break, they do a terrible job. They don't accurately break in. Thanks to this technology now, I can come on here. I can show you when Andrew Cuomo is speaking. Because we have to be informed right now. So I'll try to be back tomorrow. Try to give you another update from Andrew Mark Cuomo. I'm tired. I have other things I gotta take care of personally today, virtually. So trust me, it's chaos today. Just utter chaos. And I have to deal with other things. So thank you all for watching. This has been a special report from Andy's Randomness.
This has been an Andy's Randomness special report.